Morning and welcome and thank you so much for tuning in to our second webinar on early childhood educator compensation research. My name is Dr. Libby Saunier, the Executive Director of the Louisiana Policy Institute for Children. The Policy Institute is a nonprofit, nonpartisan, independent source of data, research, and pertinent information. In 2022, the Policy Institute began intensive work to respond to the ongoing compensation crisis within early care and education, to examine the issues, develop provider-centered recommendations, and determine next steps for improving early care and education workforce compensation. Today, I'm happy to introduce our Partnerships Director, Dr. Candace Weber, to speak a bit more about the work around compensation in our webinar today. And I have to say, this is really Candace's brainchild. And so I'm so excited to be in this second webinar that we are hosting today. And I'm going to kick it over to Dr. Weber.
Thank you, Libby. And good morning, everyone. Really excited and happy to be with you all this morning. In the first webinar of the series, we explored current wage rates for early educators in Louisiana, as well as strategies for increasing wages at the local level. And so during today's webinar, we will focus on another strategy for increasing compensation, and that is setting wage scales. As Libby mentioned, the Policy Institute began its work specifically around early educator compensation in 2022. And one of our first reports was professional wages for professional educators. And this report included recommendations for improving early childhood workforce compensation. And one of the leading recommendations in that report was the creation of wage scales, which would standardize competitive wages in the field. And so building on that work, today's webinar will look at wage scales in other states and how they can be helpful in increasing early educator compensation. And so just to give a view of that compensation research, our report showed that today in Louisiana, early educator wages vary significantly. Although we're showing some early signs of progress in increasing compensation, most educators in Louisiana still make less than $15 per hour. And in some regions, the majority of early childhood employees make less than $12. And so to give you context, the current family sustaining wage in Louisiana for a two-parent, two-child household is $23 per hour per adult. And so you see the disparity or gap between family sustaining wage and what the majority of our early educator workforce is making. And so we know establishing compensation scales provides opportunities to standardize competitive pay for all staff involved in the delivery of high quality early care and education services based on their role, their qualifications, and experience level. And so you can find the full report in our research online, our website, policyinstitutela.org/ECE-workforce. I believe that's going to be dropped in the chat for your convenience. But now I am very excited to introduce Dr. Theresa Hawley as our first speaker. She is the Executive Director of the Center for Early Learning Funding Equity in Illinois. The organization has also been termed CELFIE. And so she is going to start our conversation about wage scales. CELFIE has worked with a number of states to develop and implement wage scales, and Dr. Hawley is an expert in early childhood programs and systems that support the school readiness and social competence of young children in poverty. In her previous role as Director of Early Childhood Transformation in partnership with the Governor's Office, she directed the design of changes to Illinois' funding mechanisms and governance structure for early childhood education, again, in partnership with the Governor's Office. And so Dr. Hawley, welcome, and thank you for joining us.
Thanks so much. I'm excited to talk with you all and share with you a little bit about what we've been doing in Illinois and a few other states. So on the first slide here, just a little bit about CELFIE. We are kind of a combination of a think tank and a consulting service that is located at Northern Illinois University, one of our state universities. And we've been helping folks all across the country really redesign the funding system for early care and education, because we think that's the primary mechanism by which we're going to get to a more equitable early childhood system that's simpler, better, and fairer for kids and families and providers. So on the next slide, we're going to start. I'm going to take you through our story in Illinois about the work that we've been doing there and the really great leap forward that we've made in terms of supporting compensation for early childhood educators. Share a little bit about that. After that, I'll tell you a little bit about some things that are happening in Colorado, and through it all, try to weave through what our ideas here at Selfie are about how you can actually use salary scales to push your system towards getting greater compensation for folks who are in the early care and education field. On the next slide, I mean, our story in Illinois is the same as it is across the country. We've got programs that have staffing shortages, lots of programs who are not able to open classrooms because they just don't have enough staff, and therefore there's just not enough services in communities. Especially having a problem keeping qualified teachers in our state pre-K programs and especially community-based programs. And all of this has definitely been made worse by the pandemic, but it's been a long-standing problem in our field. This staffing crisis in early care and education has been building for decades, and it really is driven by compensation as being too low in this field. The old adage of parents can't afford to pay and teachers can't afford to stay really defines what's happening in Illinois, just like it does all across the country. On the next slide, this is really the heart of what I want to say today and talk about with you is when we think about developing a strategy to improve compensation in the field, the first thing you need to do, we believe, is to create a salary scale. Why? It's that old adage, if you don't know where you're going, you can't decide how to get there. So the first step is thinking through, where are we trying to get? We of course need to understand where we are currently. And I love the data that you guys have been able to pull together about where we are currently. But then you got to understand where it is that we want to go. Then from there, you can start plotting out how is it possible for us to get there. What we do is develop that kind of salary scale. And then the next step we believe is doing a cost model to understand how much would it actually cost to take the system we have now and bring it up to a system that is paying the kind of wages that we need to attract and retain highly qualified staff. So we call that modeling out the delta, the difference in cost between the current salaries and the needed resources to pay the salaries and wages that we need and the benefits that you need in the system. And then last, you got to then come up with the ideas of how would you actually get that money into your system, designing funding mechanisms that support better compensation in the field. And what I'm going to tell you about for Illinois is something called Smart Start Childcare, which is the state's approach to doing that. And I'll show you a little bit about a similar approach that's being done in Colorado. And lots of states around the country are trying out lots of very different strategies here, which is exciting. There's a lot of natural experiments going on out there about how you can actually close this gulf between what folks are making now and what they need to make for us to have a sustainable field. And the next slide, so why a salary scale? We need to understand what the true cost of providing high quality care for children is. And that means what is the cost of doing the programs with competitive wages that will attract and retain people in the field. We harp on this over and over again. It's obvious that in some respects, it's good, but not enough if people are making a living wage, if folks could make a higher wage in another industry that for which they are also qualified. If you've got to pay wages that are competitive with other opportunities that staff may have, or honestly, people won't do it. Like we all know this ourselves, right? You can love your job, and there's only so much wage penalty you'll take for loving your job. If your wages are just out of whack with the overall economy, we're not going to be able to attract and retain people in the field. So when we do our research, we really try to understand wages across multiple industries in a state, not just the education industry. We find this is particularly important because education wages vary in very weird ways across states, in ways that things like healthcare wages or hospitality or retail do not differ. And so we want to look at the whole economy when we're looking at how do we think about the wage scale. We looked at how a lot of other states did things, and we're starting to develop our own methodology at Selfie, but you'll see a lot of things that are similar to the way other folks have done this across the country. And then we definitely want to do some deep research in the state as to what people are being paid now. And that will help inform how you structure a salary scale as we move forward. So I think you'll understand more of this as I go through what it is that we actually did in Illinois and how we built out that scale. So our process on the next slide, we always do a very a community engagement kind of process. We start with partners in state government. These are, you got a bunch of logos here of a bunch of different state agencies and state entities that we worked with to develop this scale. But I will tell you, we did a lot of focus grouping as well. And that absolutely informed how we developed this salary scale. We want to make sure that the voices of folks in the field are informing everything that we do. And every state that we've worked, we've done those kind of that outreach in those focus groups. The next slide is really dense. Don't worry, I'll walk you through it. But we had to make decisions about a lot of different things as we went to develop this salary scale. I'm not going to go through this in full detail. Hopefully you'll get the slides later if you want to be able to review them. But importantly, we looked at what would it be to have parity, meaning how do you get to the same kind of wages for the same sort of skills and job? How do we make sure that a preschool teacher makes what a kindergarten teacher makes? So that's our first thing. Where are we trying to benchmark ourselves to? Looking at economic indicators like a living wage to make sure that we're setting up a scale that does set up the providers for success economically. So want to make sure that we're not just going with a minimum wage, but allows for that, that living wage. That also informs how you think about geographic differences across your state. It is using that, that living wage as an anchor. We wanted to take into account how we were thinking about years of experience in our scale. And what you're going to see, I'm going to show you the scale that we came up with for Illinois. We actually pegged just what we think is the minimum that folks should be making in this field, with an understanding that people should get more than that if they have experience. And in all of our cost modeling, we always assume that people are going to make more than what we say that the wage scale is, because we have to take into account that band of salaries that would be above the minimums that we're putting in this wage scale. You have to look at the geographic boundaries. How is this going to vary across the state? I'll say more about that. What roles are you going to include in your wage scale is an important decision point that you have to make. In Illinois, we really just focused in on teachers and assistant teachers in the wage scale, because we knew that would drive the wages that other folks in the field would make, directors and education coordinators and things like that. And we zeroed in on teachers and assistant teachers. And then we also had to think about things like, do you want to consider add-on rates for additional credentials, or in our state, really importantly, bilingual teachers needing to make a little bit more to compensate them for important skills that they have, that they're bringing to the classroom. So a lot of different decisions, it's a complex process to develop this kind of wage scale, but there is data out there that can help ground all of these different decisions as you build the wage scale. And on the next slide, the first decision we usually make when we go and look at a state and try to create the wage scale is to figure out what geographic regions we're going to use in the state. Is it going to be one wage scale for the entire state? Does that make sense in your state? Do you need to have multiple wage scales that are for different levels of geography within your state? In Illinois, when we did this work, we were midway through implementing a $15 an hour statewide minimum wage. So the minimum wage had been going up $1 a year statewide for several years. That was actually making much more consistent what wages people were making across the state. It's a lot less varied than it was maybe 5 years ago. For those reasons, we decided to just have 2 regions in our state. The Chicago metro area, where wages and cost of living is definitely higher than the rest of the state, and then sort of the whole balance of the rest of the state. So we just have 2 regions in Illinois. And as this says, 75% of the state's population actually lives in that in the Chicago area in our state. So on the next couple of slides, I'm going to actually show you what the salary scale is. Again, it's a ton of detail. You don't have to, understand every bit of it. You'll be able to look at the slides later, but I'm going to walk you through a little bit of what we did to try to build this salary scale. So on the next slide, this is what we created for the Chicago metro area. Keep in mind, this is 2022 when we did this. We're in the process of redoing it now for Illinois and updating it all. But what we were able to do is, I wanted to walk you through a little bit of how this is set up. So on the left-hand side, you have the position. So we said, if you are a teacher, you should make about $1.25 an hour more than an assistant teacher with the exact same credentials who's working in the classroom. That is something we did through focus groups. People said that's where they wanted that difference to be. So and then we know that in the next column, we have several different kinds of credentials in our state, and we wanted our wage scale to match the credentials that folks have. And that sometimes that people have a credential and they're the assistant, they might have the same credential and be able to be a teacher in our state. It does overlap quite a bit, so we created this overlapping structure for our wage scale. To understand what we mean in Illinois by like an ECE level 2 or 3, that's kind of like a CDA. So that would be like an ECE 1. An associate's degree is more like that ECE 2, bachelor's degree with ECE 3. And then where it says PEL, that's a professional educator license. That means that they're licensed to teach in our public school system. How we then created the salary scale was to use anchors. And I put the little anchor symbols there to see, you can see where we anchored our scale. So we anchor the bottom of the scale. What is the minimum that anybody working in this field? The assistant teacher with the minimum qualifications, which in our state is a high school degree or a GED, and no experience. What do we need them to be making within this system? So we targeted that at $18 an hour in the Chicago metro area. And we did that using some of the living wage data, but also the data on what people were making at Target. You know, what are people making in other industries that in order to be able to attract and retain staff. Then we put our anchor at the top of the scale as well. The top of the scale, we use what are folks making in the K-12 system if they have a BA. And we did change that from a 10-month salary to a 12-month salary. So we added 20% to what people are making in the public schools for 10 months and came up with a 12-month salary that we wanted to target for folks who had the bachelor's and that PEL. Now we have the two anchors for the system, and then we are able to fill in all the levels in between. And again, that's a lot of the bottom and the top are kind of science. The middle is art. It's working with folks and building out what we think that the right gradation is across all of those levels. So this is a salary scale that we came up for the Chicago metro area. On the next slide, you can see what that looks like in the balance of the state. I will say when we tried to look at pegging the bottom of the scale to what folks, to the living wage, we had a lot of places in our state that the living wage for one adult with one child, or one adult, no children, was actually significantly lower than this. So we went more again with what folks were making in other industries. So what did we do with this? Now we have this salary scale that says this is where we need to get to, this is where we need to go. In the next slide, so the Smart Start initiative that we have in Illinois is really trying to first focus on bringing up the bottom, bringing up the wages of folks who are at the bottom anchor of those scales and trying to get the wages up across our field. We have other initiatives I'm not going to talk about today that also focus on rewarding people for having the higher levels of credentials. And I think they can drop into the chat a link to a bunch of different papers and resources we have on the Selfie website that describe what we've been up to in Illinois, as well as what's been going on nationally in other states. So on the next slide, the Smart Start childcare is one component of a comprehensive initiative called Smart Start Illinois that is focused on home visiting, early intervention, preschool expansion. But here I'm going to focus in on Smart Start workforce grants, which are for the childcare industry. Next slide. And the idea here is that the state is giving grants to programs to help them pay better wages for their staff. So providers receive a Smart Start workforce grant, and in return, they must pay their teachers and teaching assistants at or above a required wage floor. So I'm going to show you a little more detail of what that is. So on the next slide, I know I'm going fast, but you'll get the idea here. So the state is saying, if you take a Smart Start Workforce Grant, you must pay. If you are in Group 1A is Chicago metro area, Group 1B and Group 2 are different parts of the rest of the state. If you're in that Chicago metro area, you have to pay your lead teachers at least $19.25 an hour. You have to pay your assistant teachers at least $18 an hour. You can absolutely pay them more. And when we did our cost modeling, we assumed that you would pay many of them more than that. But you can see how much higher this is than what folks are currently making in the field. So these are our $3 and $4 an hour raises for folks across the state that the state is giving resources for. On the next slide, you can see that we're including family childcare in this as well. For family childcare, it works a little different. There's the wage you're required to pay the teacher assistants. If you have an aide in your family childcare program, the rest of the grant just goes to the bottom line for that family childcare provider to raise their compensation. On the next slide, how are folks supposed to be able to pay those higher wages? Well, the state is giving them grants, an annual award of $27,000 for an infant toddler classroom, or $24,000 a year for classroom for kids ages 2 to 5. That has to do with our licensing setup and how many teachers you have to have in each classroom. So again, what we've done is figure out what the gap in wages is and design a funding mechanism to get that money to programs and require them to pay the higher wages. We're the first state in the country that is doing something like this. On the next slide, that it shows you it's not all programs, it's only licensed centers in family childcare. They have to be open, they have to be full day year round, and they have to be serving a minimum percentage of kids who are receiving our childcare assistance. And that's going to be probably about 15%. So it's targeted on programs that are doing that. I'm going fast, I know, and I'm a little over my time here, but on the next slide, you can see that Colorado is doing a fairly similar thing and has gone through a similar process. So on the next slide here, in 2022, Colorado had an early childhood compensation task force that was asked to come up with recommendations to the state to how to address the low compensation in the field. And that task force spent the majority of its time working on the issue of where do we want to go? What is the salary scale that we want to have? And on the next slide, this is from their slides. Why did they focus on salary scale so much? Again, wanting to make sure that they were honoring regional differences. So in Colorado, we did the same process of figuring out how many regions did there need to be. In Colorado, it needed to be more. I think we ended up with 3 different salary scales to cover what they called high, higher, and oh my Lord, high, which makes sense. You know, the Rocky Mountains, it can be very, very high out there. So it was to create these salary scales to serve as an input for the cost modeling that they needed to do for their programs, but also to help them think about what would the strategies be that they could invest in programs to raise those wages to get them closer to what they were setting as that North Star with their salary scale. What they decided to do in Colorado was to pilot a set of stipends for folks in the field. So on the next slide, they wanted to use stipends because they didn't want to do one-time bonuses they thought going to make a real difference in the field. They thought that stipends would be a clearer retention strategy for folks who were in the field and help to lower the high rates of turnover that they were seeing within the field. How they structured those stipends on the next slide, they really gave a lot of thought to. There was some kind of underlying universal stipend. There's an amount of money that everybody needed to make because the wages for everybody were too low. And how do we raise that up? But on the top, they also said, look, there's some parts of the state that are in much worse shape than others in terms of the gap between what people make now and what we need them to make. So certain regional shortage areas, they wanted to give an additional bump to their stipend. They wanted to give an additional bump for programs that were serving low-income families, so ones that are participating in the child care assistance program, et cetera. Infant toddlers were a place of particular shortage, as well as multilingual educators. So they wanted bumps for those people as well. And so they created a pretty comprehensive stipend system that said, based on all these different factors, different folks will get different amounts of money. This is different, different states have approached this different ways. Some states are doing, everybody gets the same amount of money. lots of states have come up with more complex ways like this to differentiate how much more money people get, informed by the salary scales that they've created. On the next slide, you can see how this then plays out for the Colorado stipend system. So the gray is like everybody gets a certain amount of money based on whether you're full-time or part-time. And then you might get layers of additional stipends on top of that because you fall into one of these categories. You're serving infants and toddlers. You're in a region with a shortage. You're serving CCAP kids, child care assistance program kids. So again, multiple levels here. Overall, it all comes back to the same overall process here of how a state or a community thinks through how it can get resources to providers so they can actually raise wages in the field. And the next slide, it is this kind of three-step process. Oh yeah, sounds very simple. Right? Each of these steps actually has about 14 steps underneath it. But step one, figure out where you're going. Set that salary scale. Step number two, figure out how much it would cost to get there. Do the cost modeling, understand the delta. Step three, lay a path. What is your strategy? Designing a strategy that you think is going to work for your state, for your particular goals, and for the resources that you have for the system. I say that in Illinois, we really wish we could have done Smart Start workforce grants for every provider, whether or not they were caring for CCAP kids, so we could really drive the whole field. We simply didn't have the resources to do that, so we had to create a strategy that fit the resources that we had at hand. So that's a whirlwind tour of a lot of different strategies that states have been having. Again, I encourage you to go to our website and see some of the things we've written up about strategies that are in play in a few other states. And to say, since we're transitioning over to Michigan now, we're very excited to be partnering with them too, to think about strategies, because we're so excited about the energy that is there in Michigan for making sure that providers are receiving just wages for the work that they do.
Thank you so much, Theresa. Wow. I mean, just a wealth of information. I do see a question in the chat. I will encourage you all to please continue putting questions in the chat if you have any questions on what Dr. Hawley shared, or just for specifically. We will get to them at the end. And as she mentioned, we are now excited to get a closer look at another state that Selfie has worked with very closely. And so at this time, I'd like to welcome Joan Blough. She is the Senior Director for the Child Care Innovation Fund at the Early Childhood Investment Corporation, which is currently working with providers to pilot a wage scale in Michigan. Prior to her current role, Joan was the Community Systems Director for the Early Learning Division within the state of Oregon. This is where she helped lead implementation of the country's largest investment in early care and education. That is a $400 million investment that included a strong focus on equity and child care innovation. Her portfolio included the professional learning system for Oregon's early care and education workforce, the child care resource and referral system, which is inclusive of 13 regional entities and 211 Find Child Care. Her portfolio also includes the quality recognition and improvement system for early care and education programs and providers, known as SPARC, and the statewide network of 16 early learning hubs. Joan, we are happy to have you with us this morning, and I will turn it over to you.
Good morning, everybody. Great to be with you. Super excited to have the opportunity to talk to you a little bit here at the top about the Child Care Innovation Fund and the Early Childhood Investment Corporation and the work that we've been doing in Michigan. Next slide. So here at the Early Childhood Investment Corporation, we've been in existence for about 20 years. We are a not-for-profit organization that essentially is considered a component unit of state government, but we are also an independent organization. So our board is appointed by the governor, but we are able to solicit and to grant out any kind of funding. Here at the Early Childhood Investment Corporation, we're super excited to have created the Child Care Innovation Fund. So it was a first of its kind effort to reimagine childcare through what we like to think about as common sense cross-sector solutions. We think that's really where the sweet spot lies with regard to making fundamental shifts to the status quo in the childcare system as it currently exists in Michigan. And one of the things that I'm going to be talking about today is how important it is for us in our work to always be centering the people for whom we're designing for. And so you'll hear a lot in my presentation today about how much we want to learn from childcare employers and childcare businesses as we're crafting strategies. And that's really at the heart and soul of some of this common sense work. So next slide, please. So the purpose of the Child Care Innovation Fund is collaboration. We work with regional and community partners, including economic development organizations across the state of Michigan and the public workforce agencies, which are our new cross-sector partners in the last few years. We also invest in innovations broadly, and I'll be talking a little bit more about that, but in particular, we want to make sure that our innovations are really benefiting multiple people who are affected by childcare problems, like working families, childcare business owners, and early educators. And then a key part of our work is that we invest in innovations that lead to policy change. So we're really looking to design, pilot, and scale with an eye towards changing state policy to better align with the needs of children and families, childcare, business owners, and early educators. Next slide. As we started the Child Care Innovation Fund, this is where we saw opportunities for powerful systemic change, and this is where our investments have focused. We've really spent a lot of time creating synergy between economic development and childcare sectors, and are continuing to do that work with 16 coalitions across the state, creating childcare supply building plans. Today, I'm really going to focus on this aspect of our work that's around improving compensation and on the job supports for early educators. But you can see from the other items on the slide, we try to take a broad view of what we think is significantly contributing to the childcare system's kind of perpetual woes and where we need to invest the most to make change. Next slide. So one of the things that we do at the Investment Corporation is we run a coalition called Think Babies. And last year, they produced a really important comprehensive fiscal analysis. And you heard kind of Theresa talking about the importance of fiscal analysis and cost modeling. And so this initiative produced some cost modeling for childcare, which really started to kind of kickstart this larger effort around the wages pilot that I'm going to be talking about further soon. We also had an important report released from maybe non-usual early childhood suspects like the U.S. Chamber Foundation, the Michigan Chamber, the Grand Rapids Chamber with ECIC that really talked about the economic toll that the lack of childcare was having on the state, and really defined wages and competitive wages as part of the problem. So that seemed an important signaling to us too, that the business sector understood that things were changing and wanted to have a voice in all that. We're also doing an important project at the Early Childhood Investment Corporation, which I won't be talking about today, which is giving grants to a subset of infant and toddler childcare providers who are participating in subsidy. And many of those programs are using their stipend for wages. So that is happening. And then we also had a really important call to action from our governor and our early childhood state agency around a vision for pre-K for all. And so that's really brought with it a recommendation for compensation parity included within the roadmap report. So hopefully you can see that the conditions in our state were pretty ripe for the work that we were doing. And I'll be starting to talk specifically about that now. Next slide. So this wage scale pilot that we're doing, the Investment Corporation is leading, has 4 key elements to it. Some of these are going to sound very familiar to what you heard Theresa talking about. One aspect of it is the convening of a task force for equitable early educator compensation. And so in keeping with our practices at ECIC, we brought together childcare employers, parent leaders, and others, which I'll be talking more about in a moment, to really make sure that that task force was representative of diverse perspectives and not only could help us advise us, but would help us be able to make progress on this issue on the other side. Another aspect of our pilot is the development and evaluation of a wage scale, like Theresa talked about. A difference for us was we were directed by our funder to use a wage scale that had been developed for the city of Detroit by the Corporation for Skilled Workforce. So we were, again, building on other efforts that were at play in the state to develop our scale. We also had the element of piloting, which I'll be introducing you to the 2 childcare businesses that we're working with, and then a very big focus on educating and engaging people around this issue and embedding it within the different projects and work that we do at the Child Care Innovation Fund. Next slide. So here's the membership of our task force. We really tried to think about some of these, again, cross-sector partners, so including the chief talent officer from the Michigan Economic Development Corporation as a member. I'll be talking about in a moment the fact that we collaborated with an organization called FIRST, which is a CEO alliance, to develop our wage scale, because we were trying to really think about how do we get business leaders directly involved in this issue. So I'll talk a little bit more about that. But this task force has been important up until now in helping to advise us on things like, should we focus on providers that are serving infants and toddlers? Because we know that's a huge shortage issue for us in Michigan. And they said, absolutely. We definitely don't want to pilot this wage scale with childcare businesses that aren't serving infants and toddlers. They also helped us advocate to get additional preschool development grant dollars so that we could run this pilot longer than we had initially been allowed to do so. So they've been really helpful to us, and we hope are going to be key in moving the issue forward and for the long term. Next slide. So balancing the scales was the title of the wage scale report that we prepared in partnership with Talent First. They proposed a scale that was on par with K-12. And we had the opportunity to, they hosted these reports on their website. They were developed for all of our economic development regions specifically, so they aligned with some other work that we were doing. We've hosted some webinars, and the scales contained in these reports really is being piloted in a research study with these 2 childcare businesses, which I'll be talking more about in a moment. It was a really great process to develop a scale, to have a scale developed. I think it's brought on a lot of important conversations that Theresa was talking about. And I think at least it's feeling, I think to us right now that, it might take more than one try to get it right, because as Theresa said, so many people are trying things. So we are really excited to be working with Selfie, and I'll be talking about that a little bit more here in just a moment, to take the current scale that is currently being piloted and really study it deeply as a part of our evaluation. So next slide. So as we thought about doing this very small pilot, again, with preschool development grant dollars, with 2 childcare employers, we really thought about how do we frame this in a way that feels right and fair, given that we were through the use of this wage scale, really going to be doubling people's current salaries, but only for 9 months. And so we thought a lot about the unintended consequences of doing that. And I've heard stories, I'm sure others have too, that practice of raising wages and then not being able to continue it has been something that people have found, no one wants to be doing that. So we believed we needed to frame this as a research study so that we could get the express permission of every person involved to really understand this and what it meant to take these wages, and that it might affect important benefits that they were eligible for. And I think tried to do to the greatest extent possible, making sure that it wasn't just the employer that got to decide that this was going to happen, that every single person working in the organization could opt in or opt out in the teaching staff. So we had 4 key things that we were hoping to gain from this research study, which was we wanted to, of course, test the scale. What was it like to implement it? As I've been talking, we were really trying to fit this into our larger, more long-term strategy for how are we going to get a wage scale implemented in state policy, and work with a broad coalition to finance it. We knew that there were things that we couldn't learn unless we were piloting directly with childcare employers. And so how could we do this process in a way so that even the experience of getting paid, what we asked for documentation, what that's like, because we know so many childcare business owners don't take, for example, publicly funded subsidies because they don't like the experience. And so part of what we thought was important was to test the experience as well. So we ask a lot of questions in our evaluation about the experience, and really have a very much technical assistance forward approach to how we interact with these 2 childcare business owners, because we feel that we're really engaging them as leaders in the field. Next slide. So the grants for childcare employers, as I've said, are for 9 months of wage supplements. We also covered in their grants costs for FICA and any applicable fringe benefits. We covered administrative costs and then costs for staff and time associated with participation in our evaluation. So we did pre-surveys before this started, and then we are doing a midpoint evaluation, and then we'll do one at the end. We're collecting anecdotal, qualitative stories, which I'm going to share a couple quotes with you from those. So we're really trying to, again, understand the experience directly from early educators and their childcare employer. Next slide. So these are our childcare business leaders. We have the Someplace Else Learning Factory in the city of Detroit. Staff size there, 9 teachers. They're hiring 2 lead teachers. They have 5 classrooms. So what has this opportunity done so far for them? So they've been getting payments for 4 months now in their 9-month cycle. They've been able to stabilize their current staff. No one has left. They are hoping to hire for the first time in a long time. And they have 2 staff that increase their credentials because, of course, there's rewards built into the scale. When you improve your credentials, you make more money. So people were very motivated to want to complete their CDAs because they saw their lived experience was, I'm actually going to make more money when I get this credential, which we all know is a struggle we have for advancement in our field when we don't recognize people's credential attainment in any way. The other program is up in Northwest Michigan. We have a lot of rural areas in Michigan, and even some remote areas. So it's important for us to understand what it's like for childcare business owners in those areas as well. It's about the same size place, and they've been able to hire and are currently hiring. And they have more staff than they've ever had before working on their credentials. So positive experiences on that front. And then if we go to the next slide, I always like for people to see who I'm talking about. So Top of the screen are our colleagues in Northern Michigan. And then bottom of the screen are our colleagues from the city of Detroit. And very fine people, as we all know, working really hard under very difficult conditions and really, really appreciating this opportunity to be a part of this pilot, because they so want this to change. People who want to stay in the field but cannot, without help with wages. So we also want to be able to help any of these folks share their stories. I mean, that'll be a part of us moving forward here, is how we can also use this as an opportunity to help early educators get more involved on behalf of raising their own wages, which is a really important aspect, we think, of a successful coalition effort. Next slide. So just wanted to share a couple of quotes with you. I find myself, and maybe you do as well, when I read things like this, it just hits home in a different way, just how challenging it is for our colleagues who are working with children right now. So I'm very appreciative of the opportunity that we've had to work with them and to make a difference in people's lives in this way. It's really important, I think. So what is next for us? Next slide, please. We have another report that we're writing as a part of this project, and this is where we're really going to be collaborating with Selfie, Theresa and her staff, because we think it's really important when we're piloting things that we subject them to rigorous review, because we owe it to the people we're trying to make policy change for that we get this right. So I want to talk just briefly about what Selfie is going to be doing with us is they're really analyzing the piloted wage scale, looking at it from the perspective of, is it something that we're going to be able to really carry forward? Was it helpful to pilot it, but in fact, we actually see a more successful strategy on the horizon, and we need to make sure that the scale can work well at scale. As a part of that, they're helping us develop an alternative wage scale, which we think is important, and then they're going to be doing some comparison approaches in other states so that we can really be open-minded as we work with our task force to come up with what we think are going to be critically important policy and financing recommendations that we plan to take to the next legislative session. So our final report will come out in December, and then we'll be using it as a part of the work that we'll be doing to educate policymakers about next steps. We also have an opportunity, we think, maybe for another pilot coming up from our early childhood state agency. So I share all that to say sometimes multiple pilots can really help because they give you a chance to get more people invested in what you're doing and make sure that you end up with not only the right scale, but the right experience for people. Like who should administer these funds and how that should work should be childcare, employer, and business friendly. So thank you so much.
Thank you, Joan. Again, just love all the information that you shared. And I have noted, how you guys tested the experience of those who are participating in the pilot. I think that's very important. So thank you for all the information. And at this time is actually, we're going to get into our Q&A. So if there are questions for Joan or Theresa, feel free to utilize the chat and we will get to as many questions as possible. I do want to go back up to a question that came up during your presentation, Theresa, and this was from Angelica, asking if, I think the payment, if they go directly to the centers for the wage increase in Illinois?
Yes, so and this was an important design feature that we really wanted to make sure was part of our system, that the money was paid to the centers and then it just becomes part of the regular wages that they're paying in that center. Again, lots of different states are trying lots of different approaches here. We've seen places where there's been an independent entity that just provides stipends or bonuses or things like that to providers directly. There's a lot of challenges with that being a successful strategy. One, people end up having to file their taxes a different way if they end up getting like these kind of stipends on what's called a 1099 form. And that can lead to them paying hundreds of dollars to get somebody to prepare their taxes for what might be only hundreds of dollars worth of a stipend in the first place. So we didn't want to do that. We didn't want to do, we wanted to make sure the money then went through the provider. And we also didn't want this to be called out as a separate wage or bonus. We wanted it to be built into the wages in the field. Now we work with Maine as well, and we didn't help them design, but we have helped them evaluate their stipend program up there. There it is actually, it goes through the employer. It ends up on people's W-2 form, which is important. But it ends up as a separate line, sort of like you get your wages and then you get the money from the state that's to you. You know, politically, these have their pluses and minuses of how you do this. I know in Louisiana, like people get things as credits back on their taxes, right? So that's another way of getting money into the hands of providers, all of which have their pluses and minuses about how well you can implement it, how well you can make sure it's sustained over time. But one of the things that we really wanted to highlight in Illinois was how much would it be top of mind for people that this is what I actually make in this field? Or would it be top of mind to a community college advisor who is saying yes or no, you should go into this field and try to get a credential in this field? What are the wages that people make? Because the tax credit, the stipend, the things like that generally don't show up in anybody's understanding of what people make in this field. So those are the ideas. And then, yes, the centers have to pass it on in terms of wages. It's not, you know, in Maine, it's like you get $1,000 per teacher. You're going to need to give the teacher $1,000. I think they have some things that you can pull some out for the taxes that the provider has to pay. In Illinois, we're going to give you this money, and in return, you're agreeing that you will pay this certain minimum wage, and we're making you turn in your pay records as a provider to prove to us that you actually do pay that as the wages for the staff. So it gets passed through, but not in a direct way like that. It's getting built into the actual wages of the staff.
Thank you. Great question. Great question. I have another question, and this is for both of you. So in seeing the process and the approach that you both took for your wage scales, in hindsight, what might have you done differently, if anything?
I think there's just so much research that we need to build for ourselves about what are the comparable industries here and understanding what the wages really are for those. Where else do people work if they don't, that the folks that we would want working in our field, where else are they working and what are the wages there? And understanding that by geography across the state is just a large sort of like a large database tool that somehow needs to be built for us to really understand what's happening out there.
That's such a great question. Well, I mean, I think evaluating your first effort is like the key. So, you know, that I think you're just not going to get it right your first time out, in my experience, and falling in love with your initial idea is never really profitable, that I have found. So I think that's the thing. You have to be willing to kind of beat up what you think is great and be willing to make it better, because I mean, it's kind of becoming like too important to fail in a way. You know, we're seeing a lot of, you know, we need to be able to have childcare businesses included as a part of our state funded pre-K. So we need strong businesses. We need highly skilled teachers. We have to support childcare to get that. So I'm super excited about all the ideas that Theresa shared. I think it just shows there's no one way.
Yeah, great question, great feedback. I see another question in the chat from Sonia that says, have you heard pushback on wage increases causing teachers to enter a new tax bracket and or losing other benefits like childcare assistance or SNAP?
So I think it's super important for us to understand. I mean, entering a new tax bracket is no big deal because it's always the marginal amount of money. It's always better to make more money on the tax side. You don't get to a tax level that makes you then make less money overall. So the difference of that, like this whole idea of if we paid you the money in a 1099, there are additional taxes that are part of the deal there that might be hidden from people, and that you end up paying your own Social Security on that money. That's a real issue and a problem. But making more money is always a better thing in the tax system. The question of like losing public benefits is a tricky one. I think in Illinois we took the stance of saying long term it is not a possible thing to say, you know, we want to both be a high wage field and be a field where most people can get public benefits. That's not a thing. And we chose we want to be a field where we have high wage benefits, but understanding how this all plays out over time is important. I will say there are not a lot of, you know, Target is not particularly zeroing in on whether people are going to lose their SNAP benefits when they say how much is it that we need to pay people for them to come and work for us. So it's something that we need to look at, and it definitely has to do with flaws in the way we structure our public benefit system, our other public benefits. We do have people able to receive childcare assistance and are looking in our state at can we raise the income ceiling for folks getting childcare benefits just for childcare workers. That hasn't passed yet in our state, but it's definitely something that, you know, we're kind of looking at and trying to understand.
I'd say all the same things as Theresa's talking about. And, you know, we're really thinking a lot about creating, how do we make sure all childcare jobs are good quality jobs? And if you look at the quality jobs principles that the U.S. Departments of Labor and Commerce have put out, it is hard to check enough boxes to feel very good about the quality of our current jobs. And so there is a bigger conversation here where working conditions, access to benefits, and other things do have to come into play, because parity is not just your wages. It is more than that. And we know that our field will be harmed without it.
Fair point. Speaking of benefits, there's a direct message in the chat that I will read. It says, can you talk about the funding sources that are being used for these pilot programs? It seems like mostly federal state dollars. And are there any plans for other funding sources to be included, or thoughts about how to continue paying these increased salaries in places that have implemented wage scales?
Well, there's definitely, so in our cost of care study that happened in Michigan, one of the things that was recommended in there was the creation of an actual fund for early childhood, a state fund, because nothing like that exists. So I think the other thing we have in Michigan is a cost sharing model. It hasn't yet focused necessarily on sharing the cost that's pegged to competitive wages, but I think we could adapt it to do so. And in that cost sharing model, it's families pay a third, employers pay a third, and the state pays a third. So I think that's, you know, cost sharing and additional state funds, I think, are the most realistic avenues that we have in Michigan.
And we're lucky in Illinois to have a governor who's a real champion for early childhood. And so in this year's state budget is $110 million of state general revenue money that went towards this Smart Start workforce, and with the intention of growing that to over 200 million next year as we spend out the last of our federal resources. In Colorado, they made good use of the preschool development grant fund to help support some of their expansion of wages, at least the piloting, you know, the trying it out using some of those funding sources.
Thank you. Can either of you speak more to how you engaged early educators and providers in the planning and implementation of your wage scales?
Yeah, I mean, as I say, we don't do anything without making sure that we have a rigorous stakeholder engagement process built in, making sure that we're reaching out to folks, doing those kind of focus group surveys. We're lucky in Illinois to have a very robust system. Birth of Five Illinois is a statewide network of local community and regional collaborations where we're able to get a lot of voice from folks in the field. And so we lean on those kind of things.
We had, as I said, I can be a little more detailed. We recruited childcare employers to be members of the task force, and we were strategic about kind of people that we thought, you know, like we wanted someone that was operating a multi-site. We wanted, you know, so really trying to understand the different types of childcare businesses that have employers. And that was important to us there. We have parent leaders who are a part of our Think Babies Coalition. We really wanted to make sure we had parent leaders involved in this work from the very beginning. So they're also on the task force. We brought the salary scales in draft form for folks to really talk through. We presented about them. And I think learned a lot from listening to employers' questions that we literally had not thought of. So, I mean, the value of that kind of stakeholder engagement, making sure you've got the 360 view. And then we are, as I said a little bit about, we are gathering data from all of the participants in the wage pilot. So we don't just ask employers, we also have survey questions that early educators answer. And so we think that's important to hear directly from them about their experiences too. And so I mean, I think in all ways we've been involving them, you know, at the design of the project, what we're doing in the pilot, and then as the policy recommendations are formulated, we'll be working with this task force to do that. So we'll be really looking to make sure that people do feel heard and that what is coming forward represents and will address, you know, their concerns.
Let me check the chat. Any other questions? All right, looks like the chat, my DM is cleared. If there are any questions that you guys think of after this webinar, please feel free to email our info box. That is info@policyinstitutela.org. We'll be sure to get your questions to Theresa and Joan and get those addressed. You all will receive a recording of this webinar, and just also want to plug our final webinar in this series will be held next Tuesday, June 11th. And this is where we will look at compensation beyond wages. And so benefits like our health benefits, retirement. So you won't want to miss this one. In the follow-up material, there will be an opportunity to register for our third webinar as well. And then finally, to view any of the reports from the Policy Institute or learn more about our organization, please visit our website at policyinstitutela.org. Theresa and Joan, thank you so much for joining us this morning and providing the information. Thank you to everyone on the call for joining today's webinar, and we will see you all next week. Take care.
Thanks so much.
Bye-bye.